we should really form a government commission to look at what are other possibilities, other ways of dealing with this problem. Now, one notion that I have, which is probably pretty naive, but it seems to me that one should take all drugs, including alcohol and tobacco, and tax them according to the harmfulness they impose on our society. That is to say, if you look at tobacco, by some data, it's costing us about $23 billion in medical costs and $42 billion in lost productivity, a total of about $65 billion. You add a lot for education and research. You divide that by the number of packs, $2.25 a pack. It says right on the pack, harmfulness tax, $2.25. It means that's a pretty harmful substance. But it also means if you want to smoke, go ahead and do it, but you're going to pay your own way. I don't want to pay for it.
And what about the person?
Rob, Dr. Mecca, do any of you, do either of you favor sending in the troops to Colombia? Let's burn them fields of coca and all that?
Well, I can't comment representing a program that is focused on prevention on some of the issues of interdiction and supplies, that supply side. But I can say this about the war on drugs, is that we have made a significant difference in the area of prevention and treatment. An increasing number of dollars and programs have shown to be working.
We've also doubled the prison population in America.
Hey, let me finish.
And we now have more prisoners per capita than any other nation in the world.
I'm talking about prevention.
It's the cost that I'm talking about.
A lot of people don't agree with that. They say, oh, come on, drug use, cocaine use has been declining since the mid-'80s. It'll continue to decline as the population ages.
How about asking kids what do they feel right now about drugs, including alcohol and tobacco? It is all down.
More kids are drinking now than before.
No, but it's actually gone down too, as far as drinking. Not as much as other drugs.
More tobacco than before.
No, it's also gone down as far as alcohol.
Young women are smoking now.
Oh, young women. I'm talking about all.
That's 50% of young people.
But I'm including all young people. The point here is that prevention.
Young women are smoking more. You're not addressing the point.
Well, no. The point is that although reefer madness is the reaction back in 1937. Since the 1980s, the prevention programs that is focused on young people learning life skills and doing positive things in their life, which is really what prevention is all about, those are the issues that have really made a difference on young people's lives. And there's just a wealth of programs that Annie knows very well about here in the state of California and nationally that have really made a difference.
It's a losing battle.
Why? Okay. I mean, demand reduction is the battle. Supply is the losing battle. It's demand reduction. That's what we want to educate our young people about.
While ever there's a demand, there will be the supply. And the wonderful part in terms of turning the corner is the fact that finally this country is investing in demand reduction strategies.
Okay, let me put it to you this way. People like to get high. Whether it's alcohol or coke or grass, people like to get high and always have and always will. So who are you to stand in their way?
I think the general public is unanimously in support of maintaining the current laws against drugs. And I would pose to anyone.
But that's not the point.
Any naysayer, I would pose 3 questions to anyone that would even think of legalizing as a public health approach to this epidemic that's been the #1 cause of death in this country. Would you supply all drugs to people of all ages? Cocaine, PCP?
I don't think, let's dispatch with the children. I don't think anybody believes that you should give cigarettes, alcohol, coke, grass, heroin, anything to children.
Then the rationale is to eliminate the black market. 50% of the black market is for kids 18 and under.
Is it a health issue or is it a moral issue to you? Hang on a sec, you'll get a chance. Hang on. Is it a health issue or is it a moral issue to you?
Oh, it's a health issue.
Okay, more people die as a result of alcohol and tobacco abuse than all other illicit drugs combined. So let's make those illegal.
They're available. And so you're going to make readily available more drugs that are actually more potent.
Hey, as you say, as everybody agrees, all these other drugs are readily available too.
Oh, no. There's economic barriers. If you legalize these,
well, if they were so hard to get, why is there a problem?
What gives the government the right to take the medicinal plants out of the cultivation of the people and say the people can't have these medicines that they've had for thousands of years?
Even if it's not a medicine. Even if it's not a medicine, even if it just gets you high, so does alcohol.
Heroin in Southeast Asia was readily available and very inexpensive, and lots of GIs. I ran the drug programs in Vietnam. Lots of GIs used it. When they came back to the US,
how many drank?
Lots of people drank, but it was readily available.
Maybe they were trying to escape a terrible war.
But the model, what you're talking about, is when there's availability and when there is not economic, when the laws don't exist, people will use it and self-medicate to self-destruction. It's not just if it was just you wanted to shoot heroin and take cocaine and smoke your hemp, be fine, except then you're laying in the street, driving a car, incapacitated. We're having to pay the health care premiums as a result.
We have to pay it for tobacco.
Louis Armstrong smoked marijuana every day of his life and was the greatest trumpet player that ever lived.
Will you address the hypocrisy here for me? Because, you know, whether you say grass and coke is bad for you or good for you or whatever it might be, there is a central hypocrisy here.
It's definitely not good for you.
No, it's not good for you, as even the good doctor will claim. But there's an essential hypocrisy here.
Well, the question...
We say that tobacco and alcohol are fun. We promote the growth of tobacco.
Well, here's the
kills 300,000 people a year.
If today, right now, this country had no history of tobacco and alcohol use, with what we know about tobacco and alcohol, it would never be legal.
It has a history of cocaine and marijuana use
but the history, there's a big difference between a very
There were
small...
no prohibition laws when this country started.
Is that some people prefer alcohol, that's their drug of choice, and they're in power.
The point is, these are very harmful substances, and the question is, because we have legitimized two harmful substances, does that mean we're going to now legitimize all the other harmful substances?
Maybe
does that
how
make any
about
sense?
making those harmful substances illegal then?
That's an issue that a lot of people will say. It has,
consistent.
It has
But
been tried
your
to do
issue
so.
here is to legalize other drugs.
Well, I think one issue speaks to the other.
No, it doesn't.
Yes,
it does. No, it doesn't.
Oh, yes.
Are you going to legalize cocaine? And as we've discovered, as now crack becomes available, which is less expensive, more people are using it. We've got 72,000 babies a year just in California being exposed.
Prohibition doesn't work.
How many more babies are we going to have if it's readily available?
Maybe education.
The bottom line is interdiction is beginning to work. I just got back from Spain, worked with the military intelligence over there. 30% of the cocaine world supplies are now being diverted to Europe because it's a new market.
The figures I've heard are that we're interdicting about 10%.
But you can't just throw figures out. I mean, that's my job. But that's my
Your
official
figures
job.
are okay and my figures aren't.
My figures are accurate.
Well, so are mine. I mean, this came from the DEA, this 10% figure. The Coast Guard says we're only catching about 10%.
You know, Ron,
the bottom line is cocaine. The price of cocaine in Los Angeles has gone down to $6,000 a kilo, and that's far less than it used to be.
How much is a fifth of gin?
It's readily available.
The availability and the price of cocaine, cocaine is cheaper now and more readily available than any drug in America. And you're trying to tell me that the war on drugs is a success?
Yes.
You've taken the most dangerous substances and making them the most readily available, and you've taken the safest and making those the hardest and most expensive.
You're saying heroin, cocaine, PCP, and psychedelic drugs are the safest?
I'm saying that cannabis is the safest known therapeutically active substance known to man.
Dr. Grinspoon, how safe is cannabis? What is it used for medicinally? And how about coke? Morphine and cocaine you can get out of a pharmacy. That's legal for medical use. Cannabis, no. Why?
Cannabis is, of all the psychoactive drugs, clearly the safest. It is a drug which is not addicting. There have been many myths about cannabis. There continue to be many myths. The so-called new research of the Partnership for Drug-Free America is largely propagating these new myths. It is a drug which is much safer than either alcohol or tobacco. Furthermore, it has some very important medicinal uses. And part of the price that we're paying for this prohibition is that people who have legitimate needs for cannabis, people who suffer from nausea and vomiting, cancer chemotherapy patients, patients who suffer muscle spasm, multiple sclerosis, paraplegics, and so forth, certain kinds of epileptics, most recently people with AIDS who have nausea both as a consequence of the illness and the AZT which they get. These people not only can now eat, but they actually gain weight. But we are now in the process of writing a book on this and collecting anecdotes on this, and it's really heartrending the way these people who are very ill with these diseases have to add another layer of anxiety because they are doing something illegal. And some of them have had houses confiscated, some of them have gone to jail, and so forth and so on.
Okay, so your position is there are legitimate medical uses.
You're proposing to legalize drugs, though, that would exacerbate it.
I'm not proposing anything.
Well, no, the whole notion is, in that argument that the hypocrisy exists, therefore legalize it all. If cocaine,
or make it all illegal.
That might be...
We tried to make alcohol illegal, and the price was greater than
we have a lot
allowing
more,
it into society.
And we have a lot more